So, hello to all the viewers. With me, I've got yet another top ranker, Dr. Dheeraj Anirudh, who has secured a wonderful two-digit rank in the recently declared NEET SS examination results. So, Dheeraj, lot of anxiety, apprehensions, primarily regarding the date of NEET SS first, and then for the actual exam to happen with a slightly different pattern or set of questions, I would say, but still you managed to get a top rank. So finally, are you relieved?
Yes, sir. I'm very relieved for getting a good rank this NEET
Right.
associate.
Definitely preparing for such a competitive exam, takes a lot of toll on your mental health as well. Because I am so happy that you secured this rank immediately after your uh, residency. So once again, a hearty congratulations for that. To adjust with your residency, your university exams, and then finish it in one go, and then going to join super specialization, that is deserving definitely an extra credit. Okay.
Thank you. Thank you so much, sir.
Now, the viewers would like to know more about you. So, can you just tell your college of MBBS and post graduation?
Yes, sir. I'm Dr. Dheeraj Anirudh. I've completed my MBBS from Osmania Medical College from 2015 batch. And then I've done my post-graduation from Nizam's Institute of Medical Sciences. It's also in
Okay.
Hyderabad. I've recently passed out in February 2025.
Okay.
So, I actually belong to Hyderabad and I stay in Hyderabad. So, and yeah,
Right.
that's what I
Right. Now, coming to your journey with doc tutorials. Now, see, for NEET SS exams, at your age, it's probably not as easy during your NEET PG preparation to stay motivated, especially this exam being uh, significantly postponed NEET SS. And I'll begin with the Harrison based mini test that were conducted by doc tutorials. So after the exam got delayed, stretched, we had introduced these mini tests. So did you have the habit of writing the Harrison based mini test by doc tutorials, and how useful were they in your preparation?
Yes, sir. So I've that was during the last parts of my preparation for my theory and practical examinations from the university. So that actually kept me on track for preparing for the NEET assist. Like just those 10 questions each day, they used to like okay, I used to know where I was during my preparation. While I was more focused on preparing for the theory part, but then also these questions they made me know where I was in my preparation, and they made me stay on track. And that habit of doing those questions consistently helped me a lot during my preparation. And
And
the explanations were really good, and also the quality of the questions was really good in a mini test. Though there were only 10 questions, it made me learn a lot of things just apart from those 10 minutes.
And also regarding the MCQ practice. So, how important is QBank practice in preparation? Because I'm asking on behalf of many residents, because many of them, though they keep reading, they may not practice enough MCQs. And I just want you to tell them how important is question bank practice for NEET preparation.
Yes, so the question bank is like really important because in the end it's not really about how much you know, it's about how much you can apply on the day of the exam. So though
Okay.
we might know the same concept when we are reading it, but if a question is asked on that, we might not be able to get it right. So once you start doing those questions, and it's not just the question, the explanation below it, and you read up all of it, and that's when you know where exactly is the lacuna in your preparation. And once someone specifically sits down and asks you a question on that, that's when you know where you're going wrong. And doing it on a daily basis actually helps you like prepare and pace yourself along. Or else, if you just keep sitting down and reading the notes, you always look at the things that you've already read. You never really see the things that you don't know. So if someone asks you like that, so a QBank definitely helps a lot. And the habit of doing it every day, the consistency, that's the key.
This is what I want all the aspirants to know. Consistency in MCQ practice is important. And from what I understand, Dheeraj, amidst your preparation for the MD finals as well, you gave almost all the mini test of doc tutorials. Am I right? The Harrison based mini test, 100%, almost all you gave it.
Yes, sir. I've done most of the mini tests on live, and few things like I got married during the February. So those things I've done after my wedding. I've done it in March.
That's great. That's great. To finish your residency on Jan, then marriage Feb, and cracking NEET tests on March. Things are going good in life. Okay,
Yes,
right.
sir.
That's good.
Fingers crossed. Thank you.
Now coming to the notes of doc tutorials, because you were saying that you used to go through the notes as well, because obviously during residency you may not get enough time to go through the video lectures, but notes is something that you can carry. So did you have the habit of going through the notes as well?
Yes, sir. Like I used to carry the hard copy of the notes in my bag, and wherever in the ward, wherever possible, I used to just open it up and read it. Like few pages every day, like about 30 to 50 pages a day would help me a lot. That was the most consistent thing I did during my residency, especially
And
during the later part of my final year.
for the preparation phase, I think you might have given the doc tutorials grant test as well, and how useful were they?
Yes, sir. I've given the doc tutorials grant is like about once every 15 days to 1 month.
Okay.
Like again, that also made me prepare for the exam day strategy, like where I'm going wrong and how many questions to attempt and what kind of subjects where I'm weak at. They made me uh, get through that. And the other thing is, and also it knows where you have plateaued, and because you keep reading the things that you already know. So, because I was weak in a few subjects like endocrinology, then oh, okay, then I started focusing on endocrinology more, and then the marks started to improve a little. So it definitely helped me.
And were you performing consistently in the grant tests that were conducted?
Yes, sir. I usually used to get about 100 questions right in the GTs, but fortunately, with God's grace, I've gotten a much better score in the final GT, but with the final exam, I would say.
Yeah.
But yeah, I used to perform consistently, but it was pretty much about 100 questions right, sir.
So the best performance came when it actually mattered, right?
Yes, sir. Yes, sir.
Right. And I'm not sure whether you were there in the WhatsApp group of doc tutorials faculties. Were you a part of the WhatsApp group?
I was there, sir. I was there in the WhatsApp group, and the small questions every day and the small trivia or the small Instagram reels that were shared in that group, they actually helped me a lot, sir.
So, it's great that you've got a rank. Have you made up your mind on what to take for your super specialization?
I would like to take up gastroenterology, sir.
Gastro, right? Right.
Yes, sir.
And so, hearty congratulations. I'm so happy for the achievement that you have made, because see, people looking at outside might think, such exams are a part and parcel of a doctor's life. But, to go through that phase with lot of exams, the MD finals, you said you had marriage in Feb, and you carried on and wrote the exam. So, lot of, probably all this is a result of the consistency that you had. So many people talk about, studying well just a couple of months prior to the exam, giving it everything. But along with that, I think the bit of consistency that you had probably during the residency days actually helped you in the, final exam as well. So once again, hearty congratulations, Dr. Dheeraj, on your wonderful, wonderful achievement, and God bless you for future endeavors as well. Thank you so much for joining.
Thank you very much, sir.
Okay, thank you.